And a welcome to Professor Ian Brighthope, all the way from Australia. Professor, thank you so much for coming on. I've been really looking forward to this conversation.
Thanks for inviting me on, John. I have too, and I've been listening to you for years and years and years. Every time I go for a drive, you pop up on the YouTube and listen to it in the car. So the latest today was on conspiracy theories, and I've got plenty of conspiracy theories. They become fact after a while.
I'm afraid they do. Now, you've only got 49 years experience as a physician, but we've decided to have you on anyway.
Thank you. It's actually 51 now.
Oh, right. That's okay then. Yeah, we like our doctors to be experienced. So you are a medical doctor. You're originally an agriculturalist, so you know a lot about the environmental side. And you're a founder member of the Australian College of Nutrition and Environmental Medicine.
Yes.
So, there's so many things I want to ask you about, but we want to focus today on cannabis, particularly the CBD, cannabidiol. And maybe if you start us off with some of your experience with some of your patients where you've used cannabis extracts and how the patients have benefited.
Sure, John. Well, I first learnt about cannabis back in the 1960s, but when I graduated, we didn't learn anything at all about cannabis, but it had been known as a medicine for over 10,000 years. Documentation goes back over 10,000 years. But my first experience was when I was in private hospitals, looking after hospital patients. Some of the patients referred to me were psychiatric patients, and some of them were actually addicts, alcohol addicts, drug addicts, and so on. And I discovered that feeding them better, giving them good nourishment, and giving them a lot of love and care in the hospital helped to reduce their cravings for the cannabis. Some nutrients also,
for alcohol, yeah,
for the alcohol and drugs. And if you get the nutrients in this thing balanced properly, it starts to function better. And so a couple of psychiatrists love the idea of me helping to get their patients better. And observed some of them, and this was in a psychiatric hospital run by St John of God nuns. And the nuns would tell me that some of the patients would be going at the back of the hospital and smoking marijuana. And so I thought, well, marijuana is less harmful than heroin. So we turned a blind eye to it and discovered that it was not a gateway drug. It was an exit drug, actually reducing the need for the heavier drugs and alcohol, heroin. And then, of course, now we know people can come off some of the heavy medications, psychiatric medications, and get better. Whether they've had a psychosis or a serious depressive illness or simply post-traumatic stress syndrome and anxiety. So it's not a gateway drug anymore. It is an exit drug. So we get away from the drug side of it and the smoking side of it, because I don't endorse smoking, but I do endorse the use of the oil or the capsules or the extracts from the flower of the plant. And when I talk about the flower of the plant, I'm talking about what I regard as the sacred plant, because it has so many benefits for humanity. And the benefits coming for humanity, John, are profound, absolutely profound. We want to talk about CBD, and I'll talk about CBD. It's one of over 142 different cannabinoids. The other one that people know a lot about is THC, or tetrahydrocannabinol. But CBD is cannabidiol, but we have CBG, CBN, CBV, a whole range of different, central business district is CBD. I'm trying to figure out some of the other words for the acronyms, because it's so many now that we are studying and are being studied for a whole range of conditions, human illnesses and diseases, right across the board, right across all of the pathologies that you and your listeners are all aware of. So I call it the sacred plant because it has helped so many people. So CBD is just one of the cannabinoids, and we focus on that today. But I think there's so much in the whole plant extract or the whole flower extract that it's got an immense number of actions and activities for humanity. And we see, I'll send you some pictures if you like to ask for pictures of whatever I'm talking about, pictures of the flower, pictures of the trichomes where the oil is located in these little bubbles in the plant. But it also contains terpenes, and terpenes are these wonderful chemicals that augment the activity of the cannabis compounds, the CBD, and these actually improve its activity. So we use the whole plant, or the whole flower extract when we talk about CBD, because if the CBD contains the terpenes, then it works far better. So the terpenes, let me give you an example. If you go into your pantry and pick up all the spices, the black pepper, the cinnamon, the lemon essences, and chuck them on the floor. When you take a big breath in, it's a pleasant smell, or it should be a pleasant smell to most of us. And these are the smells of the terpenes. So the terpenes known as, for example, pinene, the smell of the pine forest, and that is very good for helping patients with their CBD and their medicinal cannabis with asthma. We find the smell of pepper, black pepper, that has got terpenes in it as well. The citrus plants, the lemons, have a lemon smell, and we have a terpene called limonene. So it's fascinating. It's such a wonderful area to work in. Having worked in nutritional medicine all my life and interested in scientific herbal medicine, this has been a real boon in terms of in giving me a huge shock of enthusiasm in looking after people. So
depressing. I've been in professional healthcare for about 48, 49 years now, and I didn't know any of this. It's a real gap in traditional Western thinking, that's for sure. So I think we have to stress that in some countries, of course, this use is not legal. It's going to depend where you are. Just briefly, what is the legal status in Australia at the moment, Ian?
The legal status in Australia, John, is that we as doctors can prescribe medicinal cannabis. It can be an oil, it can be a capsule, it can be a flower, it can be a gel, it can be skin product, as long as the doctor applies to the authorities, the TGA, for a special access for the patient. So we have a special access scheme, and we actually fill out the forms, and the patient gets the script, goes to the pharmacy and picks up their medicine. Most of the time, people are using, for medicinal purposes, they're using the oils because it is an oil, and if it's extracted naturally in cannabis oil, you get all the benefits of it in its natural form. And we see patients who have been prescribed medicinal cannabis, and they'll get a synthetic form or the synthetic chemical form of CBD. It works, but it doesn't work anywhere near as well as the CBD that's in the oil from the flower in its context.
And you can take out the THC, which is the bit that gives you the high or the buzz or the psychotropic effect, and just be left with a therapeutic oil. So we're not talking about a drug that people take for fun, for recreation, for diversion. We're talking about a therapeutic, a drug that's used to treat human pain and suffering.
Absolutely. Let me just pass by a little basic chemistry, John. In the natural form, the THC and CBD and all the other terpenes are in an acid form. When it is heated, it decarboxylizes and becomes an alkali form. The acid form is the more active, therapeutically active. However, when you put the whole plant bud or flower into a roll-up cigarette, for example, and smoke it as marijuana, then the THC is converted from its acid form to its alkaline form, and that is the form that gives you psychotoxicity.
Oh, so, it has to be so it's alkaline THC that's the problem, or what people sometimes take it for.
Yeah, we call it decarboxylated, but that's the decarboxylated form plus all of the other toxic products from combustion in marijuana cause the high or the stupidity or the couch lock, and that's not what I'm talking about. We're talking about it in its natural form, where it is actually therapeutic. Yeah.
I mean, when I was young and foolish in a place where it was legal, I did try smoking cannabis, and only once or twice. But I must say, I didn't like the effect at all. I thought, what the heck do people do this for? I didn't find it pleasant at all. But the idea of this 142 of these potentially therapeutic compounds in one plant kind of explains why it could be useful for so many conditions.
Yes.
So we've mentioned psychiatric conditions. What other sort of medical indications have you used, or are you experimenting using the cannabis oil, with minus the THC for? What sort of conditions are you looking at the moment?
John, the reason we use it is not to treat a disease or a condition. We actually treat the patient, because when we understand how it works, it works in everybody if you have a need for it. And we have in our own systems a system. We've got the heart system, and we've got the nervous system. We've got this, integument. We've got the skin system and the excretory systems, and we also have an endocannabinoid system. And the endocannabinoid system is something that we never learn about in medical school and nursing training and healthcare training. It's something that's put to the side, and we've known about the endocannabinoid system for over 20 years.
Let me just clarify what this means, Ian, if you don't mind. There's a whole system in my body that works on cannabis-type molecules in me, even though I'm not a cannabis plant. There's a whole system that works on this. Tell me more. I'm fascinated.
Every cell in your body, apart from red blood cells, contain receptors for cannabinoids.
Really? Right.
Okay, it's the endocannabinoid system, and we have different classes. We have system 1 and system 2, if you like, receptor 1 and receptors 2. And the major receptors for the central nervous system, the CBD1, they're classified as receptors of the nervous system, the brain, and the nerves. But the other system, the receptor 2 type system, is essentially on the cells of the immune system, and the liver, and the spleen, and the kidney, and the heart, and the lungs. But there is a mix-up between both type 1 and type 2 receptors. But the dominant ones are in the central nervous system, the type 1. And in nearly all of the nervous system, apart from the brainstem. So you don't have the cannabinoids acting on the brainstem, which works by itself. It's the part of the body that needs to control the heart rate and the respiratory rate. These are the vital centers, as you know. And so with opiates, for example, you overdose on an opiate, you can stop your heart rate, you can stop your heart, you can stop your respiration, and you can kill yourself, because the opiate receptors are present in the brainstem in these.
Seen it many times, unfortunately.
Yeah, unfortunately, yeah. But with cannabis, let me tell you, my definition of medicinal cannabis, it's a very safe, effective herbal medicine that doesn't hospitalize, doesn't cause social disruption, doesn't cause car accidents, and it's not addictive, and it doesn't cause withdrawal symptoms, and it's not a gateway drug. So it is a herbal medicine that has an effect on every cell in our body virtually, because we depend on cannabinoid type activity. And our brain, our nervous system, our nerves have little parts of them where we produce our own cannabis. We produce our own cannabinoids, and they have special.
So I've heard of things like acetylcholine, noradrenaline, dopamine, serotonin, all of these chemical transmitters. Is the cannabis type molecules similar to that? It's produced in nerves and goes across synapses?
Yes, it does. But it's not something like it's an agonist or antagonist, John. It is a modulator. So if the immune system or the nervous system is overactive, it will bring the activity down. If it's underactive, it will bring it back up again. It modulates. It's a beautiful substance in that respect, because if your one nerve is firing off and another nerve is receiving that and going to muscles and causing an epileptic fit, you can actually have an effect on this nerve by this nerve saying, okay, I've got too much stimulus coming in. There's a feedback mechanism, and that's the endocannabinoid. And the two major endocannabinoids, one is called anandamine and the other is 2-AG. And the anandamine comes from the word ananda, which means pleasure and peace. So I think what it does, it actually modulates not just the nervous system but the immune system as well, and we see that in patients who've got serious immunological problems, infectious problems, patients with cytokine storm, for example. It can modulate those patients. Patients with respiratory problems, patients who've had COVID and bad COVID. I've seen patients actually inhale a cloud from a nebulizer, not smoking, but from a nebulizer, inhale it and get almost immediate relief from coughing, from chest pain. It's just so beautiful to watch. And I'm talking here about seriously ill patients in distress. So the endocannabinoid system is a major signaling system, as you know, with your other neurological agents, the neurotransmitters. But this is different. This is very, very different. And let me say, every patient who is unwell deserves some medicinal cannabis, even if it's just for anxiety. If you relieve anxiety, John, if anxiety is relieving somebody with a serious illness like cancer, for example, they do better. And it helps them to meditate if they need to meditate. It helps them to sleep better if they can't sleep. And of course, for cancer patients, it's well known that the cannabis can actually, more effectively than any drug that we've got, prevent or treat chemotherapy-induced nausea and vomiting. Yeah. And, we've got some fantastic drugs to stop the vomiting, but the cannabis does both. We don't have very many drugs to stop the nausea, and the nausea is terrible for these poor patients. So
vomiting's not necessarily bad. It's that horrible nausea feeling that's horrible. And I wouldn't say just anxiety. If you're not anxious, you can cope with just about anything. Anxiety is debilitating and completely horrible. So to put this in a bit of a sort of techie language, the presynaptic neuron produces andamine. That goes across the synaptic gap. It fits into an andamine receptor, and that has postsynaptic effects. Is that basically?
No, it's the other way around. It's the postsynaptic bud that produces the anandamine, and that goes to the presynaptic, does its job, and modulates its activity, either reduces its activity or stimulates its activity, and then enzymes or proteins that are particular part of the system, of the endocannabinoid system, break it down. For the next time. So, and if there are signals coming from the nervous system to the immune system, and vice versa. It's absolutely incredible what it can do. And every patient who had COVID should have been given it part of their management. Every patient who has got long COVID should be given some medicinal cannabis, and every patient who's got vaccine reactions. The vaccine reactions, especially the nervous system ones, they respond extremely well to it. And sometimes it's just CBD, and I always say, first thing first, CBD, which is, it is psychoactive but not psychotoxic. THC in its acid form is psychoactive, not psychotoxic. So you start with CBD and see how they go, and then you add, if necessary, THC. If you are a good practitioner and you know the condition of the patient and how they may respond to CBD and THC mixture together, then it's often prescribed, especially for sleep. Look, I can't emphasize how much this is going to change our practice of medicine. It's already changed practice of medicine here in Australia. So many people have come off their psychiatric medications. And, I believed in psychiatric medications and ECT and all of these other things back in the good old days. But, John, we're moving on. We're moving away from that. We have to move away from that. And you see, also, I mean, I've a patient with over 10 different medications, including antipsychotic medications, painkillers, opiates, come off all of them virtually, and an occasional Panadol. I mean, and Panadol does have an effect on the endocannabinoid system, by the way. So,
does it? Right. The reason I was sniggering there, Ian, was it's just my own complete ignorance. I mean, I went to the trouble of writing a physiology book, and that's my picture of the synapse.
Good. It's a good picture. It's a little outdated, John.
I think many things are, yeah. But we had this classic idea that stuff comes from the presynaptic to the postsynaptic.
Yeah.
And I didn't know that the postsynaptic neuron, the neuron after the gap, was producing something that goes back the other way and actually modulates the release of the neurotransmitters from the presynaptic neuron. Is that? I didn't know
That's it. Yeah.
Wow. Yeah. I had no idea. How long has this been? Do most people know this? Have I been living in a bubble or something?
Oh no! Look, there's research coming out all the time, John, and I find it fascinating. I mean, I haven't. This is known amongst the physicians who practice cannabis medicine, if you like. There are physicians around the world now practicing cannabis medicine, and we have a great there's a great interrelationship between all of us, because we've discovered something that we've been looking for. We all patients need, and what we want for helping them. And I've seen another patient who was a MS patient in a wheelchair for a number of years, and you believe this or not, I've got a video of him getting out of his wheelchair and walking around his backyard, and getting
after the oil, CBD oil,
after the CBD, THC, and of course some changes in the diet. But there has to be a belief that we can actually reverse damage done to the central nervous system and the heart muscle and so on. We've got to start doing the research in this area, because I believe that, it does happen.
But for most patients, will they get a benefit from the CBD without the THC? What sort of percentage of people, if you like, are CBD resistant and need the CBD and the THC together?
Look, quite often, if they're seriously ill, the THC will help them and help them recover, and then you can pull them back off the THC. Let me tell you, for example, patients with severe migraine for years and years and years, crippled by migraines, if they go on a diet and avoid sugars and all of the other rubbish, they may improve a little bit. We know that for a fact. However, you put them on just simple CBD, and the migraines become controlled and better controlled. And after a period of time, some of these patients who've had intractable migraines, the migraines have stopped. and you can have a holiday from the CBD. You can have a cannabis holiday, that is, getting off the cannabis. It's incredible. We have to call it some sort of a healing power, that it modulates the system back into a manageable system. And we need more research in this area. We do really need more research in this area. I will send you a link to my Dropbox, John, with all the pictures I've got. I've got hundreds of pictures, and you can pick out one or
we'll put some up
from my lectures. You can take whatever you like and put them up. But I've got some pictures of a lecture I went to, a conference I went to, and there's a patient there. He was a gentleman, a businessman, very erudite. He got up on stage and he spoke about his basal cell carcinoma, and of course,
common skin cancer in Australia,
skin cancer on the forehead,
and in the UK.
Yeah, it came back in the lymph nodes, and it was operated on, and of course disappeared for a little while. Then it came back with a vengeance. And it didn't take long for a big ulcer to form in the neck and penetrate. And it was penetrating the carotid artery. And this poor man, he was doing everything because he lost faith in the medical profession. And the carotid artery started to weep blood. And the surgeons said, we can't operate on this. It'll be too friable, as you know. So that's the end. And he had, I hope I'm allowed to tell stories like this, because
emphatically you are. Yeah, you're not breaching any confidentiality. It's brilliant.
No.
Yes.
No, I know. I mean, I know you like evidence, but this is this is.
No. This is evidence from a highly experienced physician of his patients. That is evidence.
Yeah. Well, it started leaking. He had some friends who said, "You've got to try this." So they gave him. He did a few vitamins and that sort of thing, and he had been doing that, but nothing was really working to heal it. So he started taking huge quantities of cannabis by mouth orally. He started smoking it as well, and he got some compresses with the cannabis paste out of just
like a poultice effect.
Yes. Put it on, and there. When you have a look at my Dropbox, in fact, I think I mentioned it on that talk I did in India. If I sent you that link, you see this massive ulcer like this with all of the necrotic material and the artery bleeding, just shrinking up and healing. Unbelievable.
I mean, can we explain this in terms of a modulation of an inflammatory process effect? I'm just thinking about cancers generally. So, I mean, if you anything where you get chronic inflammation, cancer becomes a risk, doesn't it?
Absolutely.
And if these CBD type receptors on the immune cells, is that having like an immunomodulatory effect? Is that your thinking?
Well, remember, John, at the beginning we talked about the endocannabinoid system and receptors being on every cell in the body. So the receptors are on every cell in that wound. Skin cells, the dermal cells, the epidermal cells, the nerve cells, the muscle cells, all the connective tissues, the white blood cells, not the red blood cells, the white blood cells, killer cells, the T4, T8 cells, all of them have got these receptors. And so they're all talking to one another, and they're all communicating. It's like what we should be doing as human beings.
Good idea. Yeah.
But it's
so it's potentially affecting every tissue in the wound. Yes.
And I don't know how much cleaning of the wound, but when you have a look at it, there was a lot of debris in the wound. And when you've got a fungating lesion like this, it's just
horrible.
It's horrible to look at, and you don't want to go anywhere near it. But this gentleman survived, and he was there, and he showed the scar that was left. He was open and honest and I think that's the most dramatic thing I have seen in terms of physical healing in a patient. And that.
So yeah. So if you need to give CBD and THC together, that's often just for a short period of time, maybe a day or a week or what. How long? Well, what I want to avoid is the THC feeling. How long would I have to put up with that?
Oh, look, you don't have to put up with it at all, John. If it's in the oil, the only effect is you might feel a little high, or you might feel a little drowsy. It's not going to make you feel silly. You feel good with it.
Well, our sincere thanks to Professor Ian Brighthope. Now, we actually had a bit of technical difficulty on that and we lost the signal, but please just accept that as a taster, because we plan on doing much more with Professor Brighthope, both in terms of CBD and therapeutic cannabis, but also he's a specialist in various other aspects of natural medicine. So we're hoping to tap his expertise to benefit the world health, basically. So for now, sorry, that's all you're getting, but more to come as soon as we can get it sorted out. But for now, thank you.